Assalamu alaikum. In the part 2 of the anatomy of the stomach, we will discuss the blood supply of the stomach, nerve supply, and the lymphatic drainage of the stomach. First of all, we have the blood supply of the stomach. Stomach is basically supplied by the celiac trunk. So we will see the different branches of the celiac trunk. From celiac trunk arises the left gastric artery. This is our left gastric artery. Then the splenic artery, which goes posterior to the stomach and supplies to the spleen. And then the proper hepatic artery, which goes to the right side and supplies the liver. From the right splenic artery arises our right gastric artery, and this is our right gastric artery, which arises from proper hepatic artery, and it anastomoses with the left gastric artery at the lesser curvature of the stomach. So here an anastomosis is formed, and then from the proper hepatic artery arises the gastroduodenal artery. From the gastroduodenal artery arises the right gastroepiploic artery, and from the splenic artery arises the left gastroepiploic artery. These two anastomose at the greater curvature, and another anastomosis is formed. Then different smaller branches arise from the splenic branches, gastric branches, and the gastroduodenal branches, and they supply different parts of the stomach. So this is how we will label celiac trunk, then splenic artery, then left gastric artery, then we have this one proper hepatic artery, and then from proper hepatic artery here is our right gastric artery. Then from the proper hepatic artery here is our gastroduodenal artery. From our gastroduodenal artery, this is our right gastroepiploic artery, and from our splenic artery, this is our left gastroepiploic artery. Now we will see the two anastomoses on the two surfaces of the stomach. At the lesser curvature, we have the anastomosis between the left and right gastric arteries, as we have mentioned earlier, and at the greater curvature we have the anastomosis between the right and left gastroepiploic arteries, which we have already mentioned. Then we have the lymphatic drainage of the stomach, which is shown here. So first we will divide our stomach into four parts like this. Part 1 here, part 2 here, part 3, and the part 4. Now we will draw our lymph nodes on the posterior side, on the right side, at the lesser curvature, near the liver, at the subpyloric region, and at the greater curvature. So here we have celiac nodes, which are the main lymph nodes. Then we have left gastric nodes at the lesser curvature, and these are the pancreatico-splenic lymph nodes at the greater curvature on the posterior aspect. Then we have right gastroepiploic lymph nodes, and here we have the subpyloric lymph nodes. These are subpyloric lymph nodes. Then these are the hepatic lymph nodes. This upper part of left one-third drains into the pancreatico-splenic. Then this lower part of left one-third drains into the right gastroepiploic. वहाँ से lymph goes to the subpyloric lymph nodes, and from the pyloric part it drains into subpyloric, and then from subpyloric it goes into the hepatic lymph nodes, and from hepatic finally the lymph goes into the celiac lymph nodes, and from the right टू-थर्ड्स ड्रेन्स इनटू द लेफ्ट गैस्ट्रिक नोड्स, और लेफ्ट गैस्ट्रिक नोड से फाइनली लिम्फ ड्रेन करता है इनटू द सीलियक नोड्स. Next we have the nerve supply of the stomach. Stomach has basically two types of supply, sympathetic and parasympathetic. Sympathetic nerves are derived from the T6 to T10 thoracic nerves through the greater splanchnic nerves, celiac and hepatic plexuses. Sympathetic nerves are vasomotor, motor to the pyloric sphincter, and they are actually the pain sensitive nerve fibers. So pain is actually carried by the sympathetic nerves. उसके बाद we have parasympathetic. Parasympathetic supply is mainly through the vagus nerves, both right and left. वेगस नर्व जब हमारे पास नेक में से डिसेंड कर रही होती हैं दोनों, तो जब वो हमारे पास एब्डोमेन के रीजन में आती हैं तो स्टमक की एक एंटीरियर हो जाती है और एक जो है वो हमारी पोस्टीरियरली चली जाती है। लेफ़्ट साइड वाली एंटीरियरली आती है, उसको हम एंटीरियर गैस्ट्रिक नर्व कहते हैं। राइट वेगस नर्व उसके पोस्टीरियरली चली जाती है स्टमक के, वो पोस्टीरियर गैस्ट्रिक नर्व बना देती है। अगर हम ब्रांचेज़ और एरिया ऑफ सप्लाई देखें तो एंटीरियर गैस्ट्रिक नर्व जो है वो गैस्ट्रिक ब्रांचेज़ देती है सारी, और स्टमक की एंटीरियर सरफेस को, उसमें फंडस आ जाती है, बॉडी आ जाती है स्टमक की। फिर पाइलोरिक ब्रांचेज़ आ जाती हैं, वो पाइलोरिक एंट्रम और पाइलोरिक कैनाल को भी सप्लाई करती हैं। उसके बाद जो पोस्टीरियर वाली है वो पोस्टीरियर सरफेस को तो सप्लाई करेगी, अब वहाँ पर कहाँ-कहाँ ब्रांचेज़ देगी, गैस्ट्रिक ब्रांचेज़ देगी वो पूरी पोस्टीरियर सरफेस, फंडस, बॉडी और उसी तरह से पाइलोरिक एंट्रम को करेगी, बट पाइलोरिक कैनाल को पोस्टीरियर गैस्ट्रिक आर्टरी सप्लाई नहीं करेगी। दिस इज़ द डिफरेंशिएटिंग पॉइंट। One more important point is that the anterior gastric nerve terminates as anterior nerve of laterjet, and in the same way the posterior gastric nerve terminates as the posterior nerve of laterjet in the pyloric region. These are the two anterior and posterior gastric nerves and their terminal branches, which are anterior and posterior nerves of laterjet, and they are of clinical significance in vagotomy. We will discuss later. So it was all about the anatomy of the stomach. We have studied the location, size, shape, then features, openings, parts, and then arterial supply, lymphatic and nerve supply.